Hi, I'm Mike Kontos, editor for the CardioSource Biomarker website here in Chicago at the American Heart Association's meeting. Today I have Dr. Anju Bhardwaj from Massachusetts General Hospital, who just finished presenting the results from the IMAGINE trial, a multi-center study that examined different biomarkers for identifying patients who may have acute coronary syndrome presenting to the emergency department. Anju, can you tell us about your study?
IMAGINE study was a multi-centered blinded prospective cohort study which was done to evaluate the traditional and novel biomarkers for the diagnostic evaluation of ACS, which is acute coronary syndromes. So here we evaluated the traditional and novel biomarkers.
Which novel biomarkers did you examine in addition to troponin T?
In addition to troponin 2, the markers we examined were ischemia-modified albumin, hot fatty acid binding protein, NT-proBNP, free fatty acids, and high-sensitivity troponin I assays.
And what were the results? Which of these markers were helpful?
Well, what we concluded from our study was that neither ischemia-modified albumin nor hot fatty acid binding protein did not add any significant diagnostic information above and beyond of cardiac troponins. Interestingly, NT-proBNP, high-sensitivity troponin I, and free fatty acids all added significant diagnostic information for ACS patients on top of cardiac troponins. High-sensitivity troponin I had a high analytical precision for the diagnosis of ACS. And lastly, free fatty acids had overall high specificity and sensitivity for ACS diagnosis, and they did add significant information above and beyond the even context of high-sensitivity troponin I assays.
So when we're looking in the context of measuring multiple biomarkers, oftentimes it's a trade-off between increasing sensitivity and decreasing specificity. Did the addition of these markers improve your diagnostic accuracy overall?
Well, it did. What we found from our study that free fatty acids, as we know, like high-sensitivity troponin I, they had higher analytical precisions, and whenever it's we have more sensitive biomarkers, it is a trade-off with mild specificity. However, in our study, even with use of a high-sensitivity troponin I, there was the specificity was close to 86%. And the other thing was we added free fatty acids. Even in context of high-sensitivity troponin I, it significantly added the diagnostic information. So basically, we used IDI and NRI analysis, which actually further reclassified patients into their groups.
In this particular study, you just looked at a marker panel at the time of presentation. Were you able to look at serial samples?
We did look at serial samples. We have those, but further analysis are planned with those samples. So basically, what we presented today was just the baseline biomarker concentrations at presentation.
So we'll be looking forward to hearing the follow-up analysis probably in April at American College of Cardiology meetings.
We do hope so.
Thank you for this interesting presentation. This is Mike Kontos from the CardioSource Biomarker website. Thank you.
Thank you.